But really this is meant, I did prepare a couple of slides, but really this is meant to be an opportunity for people to ask questions. After hearing so much great information today and hearing all these fantastic talks, we wanted to have a little bit of a few minutes at the end of the day where people could ask more general questions, or that we could loop back to some really important, clinical care concepts. I'm going to show a couple of slides just to sort of give us give a bit of background for the next few minutes, and then it'll be open for questions. And all three of us are happy to answer questions, and I'm very happy to be sharing this panel with Dr. Gauthier and Dr. de Gusum. So HHT care, in Canada is, we do have several HHT centers in Canada. I would say not nearly enough, but we do have 6 centers, and 3 of them are represented on this panel here today. But you also had Dr. Apperly earlier from the Vancouver HHT Centre. And at our previous conferences, we've had presenters from the Edmonton and Calgary HHT centers. As I said, it's my opinion that we don't have nearly enough centers, because there are clearly some very big areas between these centers that are not, that don't have easy access to an HHT center. But we are trying very much to help encourage the formation, the development of new HHT centers across the country. And certainly the HHT centers that do exist really try to support care for people through other doctors that are closer to them. I want to tell you a little bit about what I mean by an HHT center, because we've kind of referred to this a bunch of times today, but I just thought it would be good to sort of explicitly detail this. So an HHT center is basically a team of doctors and other healthcare professionals who can all provide the expertise needed to care for the different aspects of HHT. And it typically includes HHT doctors and a nurse coordinator. So often there's sort of one main doctor and a nurse coordinator who see all the patients and who manage kind of all the first line care of the HHT patients who are part of who come to that center, and coordinate consultation with other team members. The other team members is usually a very long list. You can imagine from some of the speakers that we've had today that, for example, we'll have ear, nose, and throat physicians like Dr. Lee. We'll have gastroenterologists, interventional radiologists who treat lung AVMs, respirologists like myself and my 2 co-speakers, who are often the frontline primary care HHT doctor, hematologists like Dr. Alsam Kari that you heard from, brain AVM experts like Dr. Hetz that you heard from, and more. So it really takes a big team of people to provide the full expertise that people with HHT need. Now, not everyone with HHT needs all those specialists. In fact, most people with HHT mostly just see, like, in our clinic, for example, mostly just see myself and interact with Beth. And also there's another frontline HHT doctor at our center, Dr. Vazoris. So most of our patients see us, but when they have a specific problem where they need, an AVM embolized, then we involve our interventional radiologist, or if they need scopes to look for HHT related GI bleeding, we involve our gastroenterologist, for example. We also have other health professionals that are a very important part of our team, including genetic counselor like Samantha Fonzo that you heard from today. And we also work closely with our pharmacists and dietitians and social worker and respiratory therapy, who all support the care of our patients. So I'm speaking about, our Toronto HHT Centre as an example, but this is typically what we envision in North America as an HHT center. I already showed you this, where our centers are across Canada. Let me just show 2 more slides. Really, one is about what you can do. Sorry, that's the wrong year. You could do this. Just ignore that part about the 2021. What can you do about your HHT in 2023? The first thing is to get yourself diagnosed and your family diagnosed, and use genetic testing as needed, as we've explained. Get yourself screened for lung and brain AVMs, and repeat that throughout life with low risk testing, as we've talked about today. consult with an HHT Center of Excellence so that you can get the expertise you need. You may not need to see an HHT Center of Excellence frequently, but at least initially and intermittently, you will need that to be able to get the expertise you need for screening and treatment and preventative treatment of AVMs, and also treatment when chronic bleeding becomes a problem or other complications. It's really important also to educate the other people that look after you, like your family doctor, your dentist, and other health professionals that you come in contact with about your HHT. And here I put an example about the HHT wallet card, and I'm just going to show it to you here. So this is a wallet card that we use routinely. In fact, we try to make sure every single one of our patients has one of these. And the idea, there's sort of two main things I think we accomplish with it. The first, that the front part of the page is the left side here. This basically, we put in your name on it. We say you have HHT, and we sign it and have clinic contact info about how to reach us if they need it to reach us urgently about your HHT, and also some good references about HHT, including the guidelines reference. And so one of the first ideas about doing this is that it provides a way for us to sort of to educate the people that are the other people that are looking after you, with you right in front of them and all the information they need right in front of them, and also a way to contact us. I think that we certainly have a long way to go educating all healthcare professionals about HHT, but I think that we're making progress. And I think that the best way to teach family doctors and all healthcare professionals about a rare disease is through the patient. And so we've kind of provided this card to our patients so that they can, so that you can reach out to your doctor and educate them in a way that with all the right information and contacts. The back of the card is, as I tend to describe it to my patients, is like your HHT report card. So it's a very personalized form that I fill out for each patient every time I see them, that says what aspects of HHT they have and what type of precautions they need. So without going into all the details of this really has all the information that I want you to be able to share with your doctor. So what next? Next item on here is that what can you do about your HHT is you can participate or support research. Just as you've heard from Dr. Anzel, this is a super important this is a super important point. Like, we need your support to help move HHT care forward. And there are lots of different ways to do that, but we're inviting you to join with us and to join with HHT Canada in advocating for Canadians with HHT and their mission to support HHT research and education in Canada. One last slide I want to show you here is just about what I wanted to tell you in Canada, what trials we have ongoing and that are open for recruitment presently. So we do have 2 clinical trials going on. The low-dose oral tacrolimus clinical trial and the oral sirolimus trial, which are both for nosebleeds and HHT. So those are both still open for recruitment. And by the way, you know, this gives you one snapshot of what's happening right now, but anytime you want to know what's going on, what clinical trials are available, the ones that you've heard about today in Canada and in the US, you'll find all of these listed on the clinicaltrials.gov site. So you can just search for HHT and find anything that's ongoing right now and whether it's recruiting or not. We also have some non-clinical trial studies that are recruiting, and these are registry type studies where we learn a lot from just observing what's happened to people with HHT either in the past and relating that to, let's say, their genetics or medications they took, et cetera, but also sometimes going forward, you know, so prospectively observing them. And there's 2 big ones that are still ongoing and we're still recruiting for. One is called our HHT Registry, which is funded by Cure HHT, and we launched it at the Toronto HHT Centre, but there are many other North American centers or American centers joining it in the near future, and it's undergoing a bit of restructuring, but it's ongoing recruiting, and basically anyone with HHT is eligible. So, and any center can join in and start recruiting for the registry. The last one is it's a brain vascular malformation registry in HHT. It's actually called the Brain Vascular Malformation Consortium. Sorry for my typos there at the bottom. And this is a 15-year study, when we're in year 14 of it, where we're following people with brain vascular malformations and looking for the determinants, what factors determine whether a brain AVM bleeds or not, so that we can help guide therapy in brain AVMs. There are a number of other research projects connected to this as well, including the sirolimus clinical trial. This is a registry that's recruiting across 17 centers, including in Toronto currently still as well. So I just wanted you to be aware of those, and happy to answer any questions about them. So from here, I'm going to put away the slides, and I would like to open up the panel for discussion and we'll take turns answering the questions. They can be directed or not. We'll do our best to answer them. Thank you.
Okay, great. Thank you, Dr. Faughnan, for that great overview on really the approach to getting care for HHT, the HHT centers in Canada, and kind of their interprofessional makeup, and of course, some of the research opportunities that are available for patients should they wish to participate. So we just have a few questions to field here. So I think I'll start off with some of the questions that might have been asked for some of the previous presentations that we weren't able to get to. So the first one is great. The first one is, if I get a bacterial infection, could I get a brain abscess?
Els or Andreanne, do one of you want to try answering that one?
Well, I can give it a shot.
Thanks,
so
Els.
I think if you've got a bacterial infection, and if you have a pulmonary arteriovenous malformation or a treated pulmonary AVM, or even a shunt on a bubble echo without a significant pulmonary AVM that requires treatment, we're always a bit cautious that then you're kind of at increased risk for getting an abscess in the systemic circulation, because those bacteria are not filtered in the lungs if people have a shunt in the lungs, either due to a positive bubble echo or due to a pulmonary AVM that was treated or is still persistent. So that's why we always recommend, if treated people with a shunt get an infection, that the infection is treated quickly and adequately. And yeah, and that's why the antibiotic prophylaxis is also recommended to reduce the risk for getting a severe infection, and also even to maintain proper dental hygiene. So see your dental hygienist frequently, like twice a year, just so there's no abscess, because mostly those infections come, or quite often those infections come from the mouth. So we really think it's important to have to keep all that, or to keep your to prevent that from happening. Yeah.
I 100%
Anyone to add
agree.
something to that?
Yeah, I 100% agreed with Dr. Degussem. And I think that, sometimes I know people worry about minor infections, like an infected cut or that sort of thing. And those we don't think are any more problematic in HHT than in other people. But I quite agree with Dr. Degussem that if somebody has a kind of infection that could be severe enough that it's going into the bloodstream, then that could increase, that could cause a brain abscess in someone with a lung AVM. These are really rare things, brain abscesses, but it's quite an awful complication. So we try to be very cautious, as Dr. Degussem was saying, we try to be very cautious and give people advice to prevent it, like good dental hygiene, getting antibiotics before dental work. And if you have a bacterial infection, see your doctor to see if you need antibiotics for it. And don't delay, I think is really great advice. Thanks.
Okay, great to know. Okay, so the next question is, should I be concerned about CT screening and radiation exposure?
Do you want to answer that one, Dr. Gauthier?
Yes, sure.
Thanks.
Well, CT scan are not dangerous per se, for sure, but we try to do bubble echo to avoid radiation as much as possible. But when the bubble echo is positive, that worth the very little risk of radiation with the CT scan.
Yeah, I agree too. I think that, sometimes people are pretty nervous about doing a CT scan because of the radiation, but individual CT scans, we're not worried about the risk of that. I completely agree with Dr. Gauthier. We do we do want to be cautious about multiple repeated radiation scans that have that are what we call like high dose or full dose scans. And so it's the cumulative dose of radiation that a person gets over years or over their lifetime that could have some risk. So that's where we try to just, use scans judiciously. But when we need a scan, when we need to know the size of your AVM in your lung, or when we need to make sure that the AVM has been blocked, then it's a good judicious use of a CT scan. And the CT scan protocols that we're using are low risk ones. Thanks.
Okay. Great. Yeah, it definitely seems like the benefits outweigh the risks in a lot of these circumstances.
Well said. Yes.
Yeah. And I think it's good, like there is an alternative way, like screening can be done by a Doppel echo, so that's a really, if available, so that's a good way to reduce radiation exposure. But if there are abnormalities, then you need to do a CAT scan, because then you have to know what has to be done, right? So if there's a need for a CAT scan, then it has to be done, and then preferably with low dose, either enhanced or unenhanced, to limit radiation exposure. Yeah.
It's a great point, Els, and it actually reminds me about one of the things I wanted to say about center-based care too, is that sometimes like I'll get referred a patient for HHT and they haven't been assessed yet. And a well-meaning doctor will say, we'll do the testing ahead, and then it'll be really easy when they come to see you. So then the doctor for the patient who lives a few hours away, let's say, will order a CAT scan of the lungs with dye and an MRI of the head and a liver scan and scopes of the stomach. And in fact, none of that actually usually needs to happen unless there's something urgent going on. But rather what we like to do is just do all the testing on one day when the person comes to the clinic, or as much as we can, and to only do the testing that's needed. So sometimes when people get tested ahead of coming to see us, they get way more tests than we would recommend, or that are recommended for their HHT. And they end up going right to high dose CT scans rather than having a non-radiating bubble echo, I think, to Dr. de Goesem's point too. Yeah. So I think that it's important that, we always need to be thinking about what the risks of the tests are. And so, but there's certain situations that we do need to do the testing. But if you go to an HHT center for your care, that testing will be streamlined to be the relevant clinical testing in the most expert hands.
Great. Yeah, I guess that really speaks to kind of a resource stewardship kind of approach. Okay, great to know. So our next question, kind of related about the screening that was mentioned. What are the chances that screening tools for AVMs return a false negative? So clearing a person as fine when that person actually does have an AVM.
Really depends on the test, right? So if you the bubble echo, for example, that you've heard about today, the contrast echo to screen for lung AVMs, it has almost never will provide a false negative result. It's a very, very sensitive test. If it's done in the right hands, if it's done at a center that has a lot of experience doing it, then you can be really confident that a negative bubble echo means no lung AVMs. A CT scan, like if someone has to have a CT scan because there's no bubble echo near where they live and they need to have their testing there, a CT scan for lung AVMs that's reviewed by a doctor or a radiologist that knows a lot about lung AVMs, also a very good test at ruling out lung AVMs. But an X-ray is not, so a plain chest X-ray would miss half of the lung AVM, would miss 50% of lung AVMs. So it depends on which test, and so what we try to do in the HHT centers is use the sensitive tests. In other words, the ones that are really good at picking up even small things. And then as needed, we use a confirmatory or diagnostic test like the CT or MRI. So bubble echo is the sensitive test, and then we confirm with the CT if we need to. just one other piece of your question. If you were trying to use genetic testing to rule out HHT and you don't know the mutation in your family, okay, so this would be using genetic testing in a way that Samantha, the genetic counselor, said we shouldn't use it. But if someone did that, if someone who said, if I went, let's say, I don't think I have HHT. If I went and did a blood test and said I want genetic testing for HHT, and the test came back negative and said there's no mutation, that wouldn't actually be a very reliable result, because about 20% of people that do have HHT can have negative genetic testing. We still don't really know how to identify mutations in all families. So genetic testing is not a good way to rule out HHT in a family where we don't know the mutation. Okay, but in a family where we do know the mutation, so if we, I think Samantha gave the example of like the Berenstein family. If we know the mutation in the Berenstein bears and we want to test somebody in the family for the familial mutation, and we test them and it's negative, that's a really good test to rule out HHT. So very, very, very unlikely to have a false negative there. Those are some long answers, sorry. I get excited about all this, about what we need to talk about.
Oh, that's great. Very insightful. Okay. So next question is about like the HHT centers. So in your opinion, where in Canada should a new HHT center be placed to be most beneficial to the Canadian patient population?
Should I take this one again too, guys? Because I'm happy to. I think we really need one on the
Saskatchewan.
Pardon? Saskatchewan?
Yeah, right.
Saskatchewan, and we need the East Coast.
Right.
East Coast patients are coming, patients from the Maritimes, the East Maritimes are coming to either the Montreal HHT clinic or the Toronto HHT clinic, but there's no specialized center anywhere on the East Coast. So that to me is a big priority, and Saskatchewan as well, because though the populations are smaller across the middle of the country, the distances are very long, and we are aware that it's very difficult for patients from Saskatchewan to get to Manitoba or to Alberta, for example. And then I do think it would be helpful if we had some specialized HHT care in the territories as well. That because those are obviously very long distances as well.
Yeah, makes a lot of sense. So just to stem from that as well, do you know of any new Canadian HHT centers that may be in the works? And if not, how do I advocate for the creation of an HHT center near me?
That's a great question. I can try that first, and then maybe all three of us can answer, because we might have different ideas or different information. So I'm not aware of, other than the ones I've listed here today, I'm not aware of any additional centers that are being developed right now. But, and how do we go about encouraging their development? I think it's really great, actually, if it comes from both people with HHT and us doctors. So when I talk to doctors, let's say, for example, on the East Coast, about their patients, I try to spend a lot of time talking to them about HHT and engage them in the care of their patient. And I think if the patient is also saying, hey, we could really use more help here, saying this to their patients local, to their doctor locally, hey, we could really use some expertise in HHT here, then maybe we'll be able to find someone who'll take it on. It's quite, I think it really requires a doctor who's gonna, I mean, you heard Dr. Degussam and Dr. Gauthier, they went and did fellowships to become HHT experts, and so did I. So we decided, okay, we're gonna invest a lot of time in this. And that's the challenge, is sort of finding that central person who's going to invest time in becoming an expert, and then they can grow a center around them. So we need to, so typically it might be somebody earlier on in their career who's in a position that they might be able to take on and do some additional training or spend some additional time developing as an HHT doctor, and who would be able to carve out some time in their clinical practice to be able to take on the complex care of HHT patients. So I think that, you know, there's no easy answer to this question, but if someone out there is thinking, I have a doctor who maybe could, you know, who I could maybe engage in this, or who may, you know, maybe my doctor locally in my city would know some other doctors who might be interested, I'm very happy to talk to people and very happy to try and help out with that. What we've done over the years when there's been an interest like that is I'll come and visit. We'll have we'll do rounds. We'll have what doctors do when they want to talk about, you know, when they want to share experiences. We present, we meet, we talk, we meet with patients. So I'm very much willing to do that. And I think my colleagues as well are, you know, in whatever capacity we can. Els,
and I
any
think,
thoughts?
I think even if you are living in an area where currently there is no HHT specialist, and if you have a physician who is interested in it, I think that physician almost becomes the expert. And I think as a patient, you can almost train this physician to become an expert. And I think once this physician has the knowledge, they can probably expand their knowledge and maybe use it for other persons with HHT in that area as well. And yeah, Dr. Gauthier, Dr. Faughnan, and I, and also the physicians in Alberta, they're happy to mentor. You know, like we're always happy to answer questions, you know, and help the physicians that are starting a practice or starting to see persons with HHT to help them. Yeah.
Agreed.
Yeah, I think as you said, Dr. Faughnan, like persons with HHT are sometimes the best advocates to improve care. So yeah.
Agreed. Andreanne, any thoughts?
I'm always happy to speak to doctor in other hospital to help them with a HHT patient. And it would be great if anyone wants to start a new center, eastern of Montreal. Yes, for sure.
Yeah, I look at the three of us as we're talking here in this panel, and we're all specialists. We're all lung specialists, respirologists, and I think that most HHT centers are run by a specialist. So, you know, if people are trying to talk to their doctors and encourage them to be interested or help provide care for HHT patients, it may be more the specialists and the family doctors. Given the nature of the kind of practice specialists have. And I think one of the reasons we as respirologists tend to be involved is because lung AVMs are common in HHT, and also respirologists are what we call internists. So we're kind of trained to deal with complex problems that affect more than one organ in the body. Whereas most, for example, surgeons or interventionalists, they tend to have, they're trained more to focus on one area. So respirologists, gastroenterologists, hematologists, geneticists are some of the most common HHT center directors or main doctors. Though some centers, there are centers that are run by interventional radiologists and ear, nose, and throat physicians as well. So I hope that gives people some ideas, and certainly happy to help.
Okay, great, thank you. So touching on about how patients can educate their doctors about HHT, one of the questions was, how do I get my family doctor to acknowledge my HHT? I think we talked about that wallet card a little bit earlier, but maybe other resources or strategies.
Well, I think that's a really important one, is, if you have to bring something like a wallet card, because you're making it easy for them to know, exactly what HHT means and have some good resources and some good answers. And I find that a lot of doctors, when they page me to ask me a question about one of our patients, they say, hey, thank you for this nifty card that you gave your patient, because this is really helpful, So I think that does bridge some barriers to bring some information, and maybe, and the idea that it's information from their HHT doctor, not just sort of a stack of medical papers or something, but actually like saying, this is some information about me that comes from my specialist. I think that's a big one. And I think the other thing is, if you haven't been to a center and you ask your doctor to refer you to a center, then once you go to the center, that center doctor is going to send a nice big long letter to your family doctor saying, hey, this is what it's all about and this is what we're recommending. So that also is a nice kind of bridge, I think, to help the family doctor feel confident looking after someone with HHT and to realize that there's some parts that they could really help with, so those are a couple things that I would suggest. I don't know if the others have any additional thoughts.
Sometimes a family doctor or any physician can be overwhelmed, by HHT, just because they're unaware of it. Sometimes you just have to give them a bit more time to kind of read up on it too. As sometimes if they're put on the spot, it's kind of difficult for them to answer all the questions. The importance is that then subsequently they read up on it, and sometimes if you're able to provide them with some information, with the new guidelines that are very accessible online, that's kind of an easy access for quick education of your physician.
Yeah, great point. I just realized there was something I wanted to say about the previous question about developing new centers. I wanted to acknowledge HHT Canada because HHT Canada has provided through donations from patients and members, has provided a couple of scholarships for clinicians to learn more about HHT. And one of those was Dr. Apperly, who spoke earlier today about lung AVMs when he was taking on the leadership of the Vancouver HHT Centre. He came and did some training with us in Toronto. Another one went to an ENT physician who did some additional training. So I think that, I wanted to make sure to recognize that because, even if it's not someone who's starting out in their career, who goes and spends a year doing a fellowship in HHT, even just going to spend a week at an HHT center or having some visits back and forth is a really great way to help people develop expertise in HHT. And HHT Canada was really supportive of that. So that, that to me was a very significant thing. And you saw how great today, you saw Scott today and how engaged he is and what a great HHT doctor he is.
Absolutely. Okay, shifting gears a little bit, what virtual health services exist for HHT patients throughout Canada, especially those in remote areas?
I guess we'll probably each be able to answer differently about this, but certainly over the last few years, we have more of a mixed model of care. Like, I still think that there are a number of things that we can't do virtually that we really need people to come in clinic to do in person, like embolize a lung AVM, for example, or, some of the treatment aspects and some of the testing really requires in-person visits. But we're doing a lot more virtual visits for following up people with respect to their iron deficiency and anemia and how we're managing that, or their medical therapies for their bleeding, for their nosebleeds, et cetera. So, for us, we use in Toronto a pretty mixed model of in-person visits, phone visits, and also we can do video or OTN visits. So those are all acceptable, and available approaches.
In Montreal, I do in-person visit for the first visit for sure, and then if it's just to assess bleeding with new therapy, phone visit or video visit are good. Yeah, it's mixed for us too.
Yeah, and in Manitoba and some around surrounding parts, first visit that also like in person, right? Because I always have to, you have to assess for clinical criteria and if people have HHT or not. And then subsequent, like that's the perks of COVID, hey, like virtual care has improved so much. So yeah, most follow-ups can be phone follow-ups or virtual. However, if their anemia worsens, and I kind of want to see people in person, or if they develop kind of heart failure or other kind of symptoms, like I really like to see them in person because it's a better assessment than over the phone. But yeah, so much of the care can be done virtual or locally, you know, like MRIs can be done locally or CT scans. So yeah.
Okay, great to know. Just being mindful of the time, we do this session does end at 5, and then we'll have some closing remarks after that. So just one more question. Is there any new information on COVID-19 and HHT, whether there's increased risk or adverse effects or anything like that?
You know, I would say what we've really learned over the last few years is that people with HHT seem to respond similarly and have similar risk with COVID-19 as other people do. You know, that we had more worry initially when there was so little that was known, and also COVID disease was more severe. So we had to be very cautious about that. And though I think it's still good to be cautious and carefully avoid COVID for all of us, I don't think that HHT patients have to be more fearful of COVID than the rest of the world. I don't know what you think, Els and Andreanne, but that's sort of my impression.
Yeah, I agree. I think the only thing we have to avoid is the nasal swab. If you have like really bad nosebleeds, then like the test can also just be like a swab in the back of the throat.
That's right.
Right. Yeah, but otherwise, I don't think there's a difference in care. Yeah.
I still do suggest to avoid as much as possible tranexamic acid and medication that can be thrombotic for a patient when they do have COVID.
Right. Yeah, good point.
Yeah.
Yeah, and I think, and I think that I agree with that too, Andreanne. If someone is sick with COVID, particularly sick in the hospital with COVID, like if they're really sick with it, then we'll stop the tranexamic acid temporarily. Agreed. And we also polled, we've actually done a study that we're writing up currently, where we also asked about 200 of our patients about their outcomes from COVID vaccines, like about complications from vaccines, and it seemed to be very much what we see in the general population. So I have no additional concern about our HHT patients getting COVID vaccines either, similar to everybody else.